Welcome back. February is American Heart Health Month, a time when all people can focus on their cardiovascular health.
And tonight we're joined by Dr. Vic Graywall, a cardiologist at Cooley Dickinson Hospital, and we thank you for being here tonight.
Sure.
So I want to start with cholesterol seems to be a major risk factor for heart disease and stroke. So how do we know what our individual cholesterol levels should be?
That's a great question, actually. It's very independent, patient dependent. There's a building body of evidence that really we should be making these decisions, not just on numbers that you get in your blood tests, but really a collection of your risk factors, including your age, family history, the things we talked about earlier, like blood pressure and cholesterol and diabetes. But most importantly, you should talk to your doctor about the possibility of getting a coronary artery calcium scan. This is a scan that shows if you have plaque or not established in your arteries, and it helps us guide how low your cholesterol levels should be and how we should achieve that.
So what's the difference between good and bad cholesterol?
Yeah, so good cholesterol, which we call HDL. HDL basically goes around the body mopping up bad cholesterol and trying to keep it from depositing itself as plaque in your arteries. The bad cholesterol, LDL, and to another extent triglycerides, they help form plaque. That's atherosclerosis that builds up in your blood vessels head to toe. So when we talk about heart disease and stroke, this is what we're trying to prevent.
And what about a diet that would help reduce bad cholesterol, as well as foods that maybe you should be avoiding?
Yeah, you hear a lot of different things. Almost every year you hear competing evidence about eggs and these types of foods and whether or not they're actually good for your cholesterol levels. There's not a lot of studies that have definitively shown an outcome between specific diets or specific foods and your cholesterol levels and outcomes in terms of forming plaque. So that's why I say it's really independent for each patient. And you need to know whether you have plaque, and then we can talk about whether you need a well-balanced diet or something more specific, or if you need help from medication.
Well, thank you for taking the time to speak with us, and we will be providing more information with Dr. Graywall coming up in the next half hour on 22 News at 6.